Is your brain shrinking because you're ignoring chronic pain? Kind of a crazy thing to think about, isn't it? I'm Dr. Megan von Holtz, and I don't know about you, but I really don't want to lose too many brain cells. I really like the ones I have, and I don't want to lose them. But that is actually a statement that I put together after reading some journal articles from the Journal of Neuroscience. And I thought, I might spend some time going over them with you, because I know a lot of people don't read those basic science articles because, there's a lot of big words to get through and people give up after a few sentences. So I just picked 3 out of probably the 1,000 that are on how the brain can atrophy with pain, but I thought I would explain them to you to help you understand why it's really important not to ignore your pain. The first one is dated November 17th, 2004, and again, remember, I'm going to explain it in English, so even I'll read the title and some of you are going to get kind of glazed over eyes, but I promise I'll explain. It's called Chronic Back Pain is Associated with Decreased Prefrontal and Thalamic Gray Matter Density, in English. So prefrontal cortex, that's the very front part of your brain. That's the part of your brain that helps you with complex decision making, and it has some to do with your emotion and how you react to things. So say there's a huge traffic jam and you're trying to figure out how am I going to get to work without being late. That would be the part of the brain that would help you do that. It would also be the part of the brain that might inhibit you saying mean words that you shouldn't say to drivers as you're going through. So that's that part of the brain. And then the thalamus, actually really cool, it's right in the center of the brain. It takes tons of sensory input that you get from the outside world, like things that you see, hear, things that you touch, takes it into the center of the brain and then gets it where it needs to go so your brain can figure out what to do. And what they found in the study, they took 26 different chronic back pain patients. Some of them had sciatica, some of them just had plain old chronic back pain, and they compared MRIs of those patients to people who didn't have any pain, and they found a difference. The people who had the pain, especially if they'd had it long time, actually had loss of density and loss of actual size of the brain. Crazy, right? If I actually read directly from the abstract, it says the patients with chronic back pain showed 5 to 11% less of that neocortical, that new brain activity. It said too, it says the magnitude of this decrease is equivalent to the gray matter volume lost in 10 to 20 years of normal aging. So we're not joking here, this is definite loss. And they said the size of it was about 1.3 cubic centimeters for every year of chronic pain. So it really does show in this study in particular that there is a physical difference in your brain if you have chronic pain over time. Now, like I said, there's thousands of studies. This one's on back pain, but there's other studies that deal with different parts of different types of pain, and a lot of them show that too. One thing about any kind of study is you can't just really look at one, truthfully. You have to look at many. And with that study, we didn't really know, maybe people that have chronic back pain are predisposed to it. Maybe their brain was like that before. So this study that I found is another one from the Journal of Neuroscience. It's dated November 4th, 2009, and it says that chronic pain is actually a consequence of the pain and not the cause of the pain. So they took 32 patients who had primary hip osteoarthritis that had terrible pain from that, and they gave them MRIs versus people who didn't have any pain. And in this group too, they did find that there were 4 different areas in the brain that were smaller, and they were trying to figure out, they're smaller because of the pain, or were they already smaller to begin with? So the really cool thing is, they took 10 of those patients who decided to have a treatment that made them completely pain-free. So say 4 months later, they redid MRIs on those patients, and they actually found that some of the brain matter that had been lost had actually started to regenerate. So cool thing about this is this study is showing even if you've had chronic pain for years, if you can find a way to decrease it, your brain can actually, it has plasticity, it can kind of heal from that, which is pretty cool. This last one is, again, Journal of Neuroscience. This is February 6th of 2008. And this one's a little bit more complicated, but it was saying that, when you have pain is not the only thing that's affected, and that's kind of one of those no-brainers, like duh. When I have pain, am I more grumpy? Yes. Do I have less patience? Yes. Do I have trouble sleeping? Yeah, a lot of the times. So they were trying to find a way in the brain that those other things were showing up, and they actually did. They found a physical change in what they were calling your body's default system, which sounds kind of funny, but I think they were thinking of it like a computer. Like you set your default settings for a computer, and that's where it always goes back to. Like that's its resting state. It knows how to work from there. If someone comes in and changes your default settings, you know, it can be kind of confusing. Things don't run the same. And that's what they found here, that chronic pain actually changes some of the default settings of your brain. So people in chronic pain, their brains work differently than people who do not have pain. And I thought that was kind of interesting because that's one of the things we see a lot in people who have chronic pain is a lot of them don't sleep very well. And if you can get them in the first 2 weeks of treatment to start sleeping better, it can make huge changes. Now, you know, I never had really read a study that talked about that, but this one was suggesting, you know, that those two are correlated. So hopefully that wasn't too much science and research for you. I hope you learned that, one, it is important to deal with that pain. If you have pain, try to find a way to get around it. Obviously, as a chiropractor, I think getting the joints moving is really helpful, because if you think again about like the thalamus that was in the center of the brain that takes those sensory inputs, say my right SI joint is stuck, my brain isn't going to get those same sensory inputs, and it has to change my gait. There's no way around it. If I can get a chiropractor to get that moving better for me, I prevent that decrease in input, and hopefully I decrease the pain. But there's other ways to decrease pain too. We do a lot of work in the clinic talking about proper nutrition. We work with diabetics a lot because that overall inflammatory state that so many of us are in because we eat poor food and we don't sleep right, though that causes pain too. And if you can get rid of that pain, maybe your brain could be even healthier. Hopefully you learned something. We will see you again next week. I'm Dr. Megan Von Holtz.